Hi, Dr.Day here from Steinway Family Dental Center. We get a lot of questions about gummy smiles, and today we're going to answer some of the most common questions that we get from you on that subject. So let's start. The first question is, what is gummy smile and what causes it? Well, the gummy smile is when you smile, if you look at the smile and you show small teeth but very large gum tissue, right? And most of the time it is the upper teeth, but it does happen that it is on the lower teeth as well, or just on the lower teeth, not on the upper teeth. So it depends on the smile, right? And of course it does not look as aesthetically pleasing as if the smile is not gummy. The next question is, at what point the smile considered to be too gummy? Well, like I said, if you're showing a lot of gum tissue, right, that is above or below the teeth, if it's on the lower jaw, then that is considered gummy, and it is too gummy if you show a lot of it. The next question is, does the gummy smile affect health or only appearance? Well, it does not really affect health, but it does affect appearance. The next question is, what is the most common treatment for fixing the gummy smile? So there is a surgical and a non-surgical treatment, and the non-surgical is probably the most common. Even though it is not a permanent, a temporary treatment, but it is the most common because it's least invasive. The reason that it happens is because the muscles are pulling too hard and you show too much of the gum tissue, so those muscles need a little bit of help not to be overly stimulated when you smile. So the way it works, you would get something like Botox injection that will help your muscles to be in a little bit more relaxed position so that you don't pull them just as hard, and you will stop getting the gummy smile. The question is it permanent? And the answer is no, it is not. The Botox only works for up to 6 months, and then if you would like to repeat it, you can, or you may go and choose a little bit more permanent solution for that. The next question is, how long do results from Botox treatment last? And the answer is probably about 6 months. The next question is, can surgery be used to correct a gummy smile? Depends on the gummy smile, but yes, it could be used. There's different procedures that could be done, and it could be corrected surgically. It is a little more permanent solution, so that's the difference between Botox and the surgical solution. The next question, are there any side effects or risk for treating the gummy smiles? Well, surgical, of course, there is some sort of risk, and the same with the Botox, but it is a regular risk with using of Botox anywhere else. The next question, is it common for somebody who has a gummy smile for it to become more gummy as they age? And the answer is yes, it is common. The next question is, how do you decide which treatment is right for the patient? Well, we should discuss all the options, and then based on the knowledge that you would get, we would recommend something for you, whether to choose one or the other option and which one will best suit your particular case. And then you can make your decisions on that. I hope that was helpful and we shed some light on the subject of gummy smiles. So if you have any further questions, or particularly questions about your smile, if it is gummy and what to do with that, you can give us a call at 718-728-3314 and schedule an appointment so we can discuss that. Or you can just simply find us online on alldentalneeds.com and request an appointment, and somebody will get back to you and we can meet and talk about whatever questions you have.